Your gut is more than just digestion. There is a connection between gut and brain. When you say, for example, my gut feeling or my gut says, your gut and heart, gut and your immune system, and gut and your fertility. Why not? We have trillions of microorganisms that are sitting there which far outnumber human cells. Here are 4 ways by which poor gut health can affect your chances of getting pregnant. First, poor digestion means poor nutrient absorption. When you have digestive issues like gas or burping or acidity, you're not pooping daily or constipation, it means that even if you eat healthy, your food isn't being absorbed well. Poor nutrients means that you're not producing healthy cells and your hormone production is affected. Second, poor gut health can imply you're not removing excess hormones from your body, which can become toxic. Now, one of the biggest ways by which the body detoxes is via urine or stools. The bacteria in our gut break down excess estrogen and your stools remove them. When you don't have good gut microbiome diversity, this breakdown of excess estrogen does not happen correctly. And you end up with either lower or higher levels of estrogen that can cause a disruption in your menstrual cycles, irregular periods, impaired ovulation, PCOS, endometriosis, and ultimately even fertility. Did you know how many women are being prescribed contraceptive or birth control pills to get regular periods? Now just imagine if that menstrual issue came from a poor gut health, and how much simpler it would have been to fix the gut health rather than pumping the body with artificial hormones from the outside. Third, do you know that thyroid hormones are made in your intestine? Surprised, aren't you? Because you always thought that the thyroid hormones came from the thyroid gland that sits at the base of your throat. Conversion of T4 to T3, which is the active thyroid hormone, happens in your digestive tract. And without good bacteria, you will underproduce T3. And low levels of thyroid hormone can interfere with the release of the egg during ovulation, and which can in turn lead to infertility. Finally, fertility is affected by inflammation in your body coming from a condition called leaky gut. When you eat foods that you can't digest, example, some of you can't or may not be able to digest milk, and yet you continue to have it in your tea or coffee. While you may not show obvious symptoms like gas or bloating, that milk goes and irritates the lining of your small intestine, breaking down that intestinal wall, leading to the food particles entering your bloodstream. And that's a leaky gut. Now the body sees this half-digested food particle as an enemy and mounts an attack. The result is inflammation in your body. And chronic inflammation leads to lower progesterone levels, meaning that there can be an implantation failure. And studies have shown that sometimes this kind of chronic inflammation can also lead to recurrent pregnancy losses. So if you are trying to get pregnant, watch out for not just standard digestive symptoms like constipation or acidity or bloating, but also non-digestive ones which show that the gut health is impacted, like allergies, frequent colds, chronic headache, a sinus congestion, skin issues like eczema, and even joint pain. The next step for you is to heal the gut by creating the right diet and nutrient protocol along with some lifestyle changes. If you'd like to speak to me about possible gut issues that could be impacting your fertility, or if you want to know more about how you can conceive naturally, please message me in the comments box below, or you can WhatsApp me on the number at the end of this video and I will reach out to you.